thought maybe some of you might have an interest with the history, how NAD first came about. So I've made a very brief presentation on the history of IV NAD. I want to just mention a little bit about the origins of NAD, about its history, out of respect and out of love for Dr. Hitt, whom I visited in his clinic maybe 10 years ago, somewhere in there, and spent 3 days with him. A very humble man. His office and his practice with other MDs was in just across the border from San Diego. And a very gracious person, and as I said, very humble, and went to lunch with him a couple of times, and very open with sharing. You know, he was a pioneer in his time, and you know, a lot of people wanted to know what was in his IVs, and I think probably for selfish reasons wanted to get the formulas from Dr. Hitt, and I didn't really take that approach with him at all. I mean, I wanted to know, but I respected him and didn't want to be involved with trying to ask him those kind of questions. So he would have different physicians and students come in, and he'd teach them about what was going on. And he was doing more than just NAD. He was doing ozone and other things to take care of people's wellness. And he developed what we now know is the NAD with mixed with amino acids. And he developed 5 different formulas, which he was always kind of modifying and reformulating and improving over the years. And this was all for the intravenous treatment for NAD. So when he died, went to his funeral, and he willed his formulas to his wife, and she then tried to find a reputable compounding pharmacy that was willing to take care of these formulas and provide them for physicians. And they actually made a good modification to his formulas in that NAD, the new formulas are, NAD is what's called lyophilized, or in a form where it is fat soluble, and so that it can more easily be transported through both the outer membrane of the cell and also through the membranes that surround the mitochondria. So Anazao Health is where we get they're the only ones that are legally have the rights to these formulas and are providing them for physicians. There are others out there, the compounding pharmacies, that are doing, somehow everyone figured out that NAD was the active ingredient or component in the IVs, and so now it's coming out as coenzyme 1, which is also another name for NAD, but as far as I know, it is not lyophilized. And also I think there's 6 or 7 amino acids that are in Dr. Hitt's formulas, which are not in the coenzyme 1 formula. Not even a formula, coenzyme 1 vials. So that's a bit about the history of NAD, and a great salute to Dr. Hitt, who was a really good person. So we start, typically, almost always, the NAD IVs must be administered as close together as possible, and there are 10 vials per individual per treatment. So we will start on a Monday and go through the week. We usually skip weekends unless a person is kind of at a sort of a peak of their discomfort, because the first 3 to 4 and sometimes the 5th vial, people are experiencing a lot of discomfort, especially in the abdomen. There are the cells around the gut lining, referred to as the enteric nervous system, because they produce neurotransmitters just like the brain does, and they're often very intoxicated with these drugs because that's the area of assimilation. So, they experience discomfort in the abdominal area. They experience nausea. We've got to take this drip really slow. The first day is usually, sometimes you don't even finish one vial, which is put into a large IV bag with about 500 cc's of liquid. And the drip rate is pretty slow to tolerate the experience. And then by the 7th, 8th, 9th, the 3rd, 4th, and 5th day, they can start speeding up the drip more, but it's often not until the 2nd week. Usually the 6th IV, they're starting to come out of it. The 7th, they're saying, well, I'm starting to feel a lot better, but by the 9th and 10th, it's like, wow, I got my life back again. It's very rewarding to be in this position of helping people and seeing results like this. Thank you.